Ciera and I completed this research project under the mentorship of Dr. Sihong Liu. This research study looked at the relationship among parental stress, child well-being, and family routine in the context of the COVID-19 pandemic. Evaluating the impacts of the COVID-19 pandemic on the well-being of children is vital for the health of our society. Therefore, it is essential to ensure the needs of children are being met through enriching protective environments. To foster stable environments that provide the necessary criteria for healthy development, we must look to parents. If parents are faced with extenuating challenges beyond their means of coping, stress will likely manifest. The burden of stress can inhibit the ability to access the tools needed to provide patience, warmth, and understanding. Previous literature suggests the relationship between parental stress and child well-being can translate into deleterious effects on children. In order to reduce parental stress, it is important to examine easily accessible ways in which parents can limit the feeling of stress, especially during extraordinarily taxing events that can proctor stress, such as the COVID-19 pandemic. Other literature suggests one way to reduce parental stress may be achieved through consistent use of family routines. In order to assess the efficacy of family routines in mitigating the effects of parental stress in the context of the pandemic, I proposed 3 questions. The first question addressed how the COVID-19 pandemic impacted parental stress and child well-being. Then I assessed how parental stress influenced child well-being. I continued by asking, does family routine protect child well-being from the negative impact of parental stress? To answer these questions, I used data from the Rapid EC National Survey that began in April 2020 and is still ongoing. I compared pre-pandemic and during the pandemic parental stress. I also compared pre-pandemic and during pandemic measures of child well-being. I continued by running a regression analysis to examine how parental stress influences child well-being. I completed the inquiry with a moderation analysis that examines the impact family routine has on parental stress and child well-being during the COVID-19 pandemic. The sample obtained from the Rapid EC National Survey included 11,404 parents from U.S. households with young children 0 to 5 years old. In this context, national sample refers to the geographic location of participants, which was in the United States. The demographic consisted of caregivers aged 20 to 55 years of age with a mean of 33.21. 93% of the participants identified as female, 6.4% identified as male, and 0.6% identified as other or declined to answer. Caregiver race and ethnicity included 1.1% Alaska Native American Indian, 3.4% Asian, 7.6% Black, 76.3% white, 5.4% multi-race, 6.2% other, 16.4% Hispanic Latino. 46.4% of participants had an income identified as 200% below federal poverty level. The findings indicate that parental stress has significantly increased during the pandemic in comparison to pre-pandemic levels. Child behavioral problems have also significantly increased during the pandemic in comparison to pre-pandemic levels. Parental stress prior to the pandemic was also associated with elevated child behavioral problems during the pandemic, after controlling for pre-pandemic child behavioral problems. In other words, pre-pandemic parental stress was linked to increases in child behavioral problems from pre-pandemic to during pandemic situations. This model explained 21.2% of variance of child behavioral problems during the pandemic. In the interaction analysis, family routine assessed during the pandemic was significantly associated with reduced concurrent child behavioral problem, and pre-pandemic parental stress was no longer significantly linked to child behavioral problem while controlling for pre-pandemic child behavioral problems. However, the interaction between family routine and parental stress was not significantly connected with child behavioral problems during the pandemic. In other words, family routine did not serve as a significant moderator on the associations between pre-pandemic parental stress and changes in children's behavioral problems from pre to during pandemic situations. In summary, parental stress significantly increased since the start of the COVID-19 pandemic. Child well-being was significantly and negatively affected by the COVID-19 pandemic. Parental stress assessed before the pandemic was significantly linked to increases in child behavioral problems from pre-pandemic to during pandemic situations. Regular family routines were not sufficient in protecting children from the negative impact of parental stress. However, family routines were directly associated with lower levels of child behavioral problems. Right now, parents and children are experiencing tumultuous amounts of stress that could leave lasting effects on their mental health, well-being, and socio-emotional development. But these negative outcomes could potentially be reduced by maintaining regular family routines and reducing parent stress levels, which may help promote more optimal developmental outcomes among young children in the context of the COVID-19 pandemic. Thank you. I would also like to thank the team of individuals that helped me collect, analyze, and convey this research. Thank you to Dr. Si-Hong Liu, Dr. Philip Fisher, Dr. Christabel Dragoo, Denise Elder, and the Rapid EC research team.